The following program contains mature subject matter. Viewer discretion is advised.
Will birth control make me gain weight? What age should I get a breast exam? These are common questions women ask their gynecologists, and Dr. Nita here has some answers. Our first question comes from Snapchat. Let's have a look.
Hi doctors. During my third trimester of my pregnancy, I used to get this shooting, radiating pain down in my lady parts. And I heard it was called lightning crotch. What causes it and how do I prevent it?
Well then.
Lightning crotch.
I've been practicing medicine for 35 years. I've never heard of lightning crotch.
Lightning.
So enlighten us, please.
Let's talk about it. So with lightning crotch, women will have this intense, sharp, sudden pain in the vaginal region. Now, it can happen to a woman when she's pregnant, and it can also happen when she's not pregnant. So what can cause this? Well, there can be a lot of different causes, but just looking at 3 examples, when you're pregnant, of course, there can be contractions. Also, you have a lot of pelvic nerves in the region, and so as your baby grows and moves and stretches, then it can impinge on some of those nerves, and that can cause pain. There's also something called round ligament pain, and it's really common, especially in the 2nd trimester. And women will say, I have this lower abdominal pain, and it shoots towards my vagina. Well, the uterus is attached to the groin region by the round ligament, and as it grows and stretches, the thought is maybe the nerves around it can get irritated or, something like that. And so that can cause a lot of pain, especially when a woman moves quickly. So those are 3 potential causes with pregnancy. When a woman is not pregnant, 3 examples would be something like endometriosis or a chronic condition. Sometimes ovulation can also cause you to have some sharp pains down there. And there's one condition that's pretty serious. It's a gynecological emergency. It's called ovarian torsion. When the ovary twists, it cuts off the blood supply, and that can cause a woman to have pain, and that's something that you do want to be cared for immediately. So sometimes it's nothing, sometimes it's something, but if you ever have any questions, make sure you ask your doctor so they can make sure it's not something that's really going to harm you.
Good stuff. Let's get one more question. This one comes to us via Twitter. Our viewer writes, settle this once and for all. Does using a tampon make cramps worse?
Well, here's the thing. We don't have definitive evidence that using a tampon is going to just cause your pain to go through the roof, so that is going to be a myth. A lot of your pain with periods will come because your uterus is contracting and is trying to expel the inside lining of the uterus, which is the endometrium. And so if you have a tampon that's just sitting by your cervix, which is the bottom part of your uterus, that shouldn't be causing you to have a significant amount of pain. However, if someone has a condition that's causing chronic pain anyway, like endometriosis, fibroids, if they have a really sensitive vulvar region, if they have some type of, infection in the vaginal canal, like a sexually transmitted infection or a yeast infection, just something irritating the area. If they have chronic constipation, or psychologically, if they're just thinking this tampon is going to cause pain, then when they put the tampon in, it increases the probability that it will. But here's the thing, tampons are not something you have to use. So if by chance you feel like they're making you uncomfortable, then by all means, you can just use pads or use something else. But from an anatomical standpoint, a properly placed tampon should not be making your menstrual pain go through the roof.
All right. I'm glad you settled that.
Yes.
Dynamite!